All right, everybody, welcome. Thank you for joining. We're just going to give everybody a couple seconds to come on here before we get started. All right, so again, good afternoon to everybody on the East Coast. Good morning to, I guess, everybody anywhere else in the country. We're really excited to have a really interesting webinar for you all today. I have some really great guests that are going to share their awesome stories and talk about some amazing work that they're doing. Before we get started, just a couple quick housekeeping items. Really, the only thing is this: we set the view, so you should be able to see 5 boxes on your screen, so you can see all of the panelists on the webinar with us. If you're having an issue with that, if you want to throw something in like a chat or a Q&A, we can kind of look at it. If you have any questions for anybody at all, just put them in the question and answer box, which is located at the bottom of your screen. We will answer questions at the end. So if you have a question directed for someone in particular, just let us know and we will make sure to answer them all at the end. So again, today I'm really excited to have some great guests. And at Defibtech, we often talk about our mission, and we come to work every day, and really the basis of all the work that we do is to help save people's lives from sudden cardiac arrest. We talk about it internally a lot as a company. We talk about it a lot with our marketing, and really our focus is to increase survival rates. So we are very proud to partner with nonprofit organizations all over the country that are working directly in their communities with that same mission to help save people's lives. So today we are joined by 4 representatives from 4 of those amazing nonprofits that we work directly with. So I'm going to start here and go around the room, and we'll have everybody kind of, if you could introduce yourself, your name, the name of your organization, and where you're based, that'd be a great place to start. So Joanne, if we could start with you, and we'll go from there.
Sure. My name is Joanne Babbitt. I'm Vice President and co-founder of the John Taylor Babbitt Foundation, which is a foundation that we started 16 years ago and named after my son, who was a junior in high school at the time, playing basketball, suffered sudden cardiac arrest. And unfortunately, the outcome was not successful. And we're based out of, New Jersey. It's not a big state, so we can just say New Jersey.
Awesome. Jennifer.
Sure. I'm Jennifer Sarmento. I'm the executive director of the Kyle J. Taylor Foundation, which is in honor of my son, Kyle, who passed away at the age of 18 in February of 2018 from sudden cardiac arrest. And we started the foundation in his honor. We are based in Northern California, in the San Francisco Bay Area in California.
Cool. Jamie?
Hi, my name is Jamie Enzer. I'm founder of The Beat Goes On. We are located on the eastern shore of Maryland, and I started this nonprofit about a year ago because I am a sudden cardiac arrest survivor out of hospital 3 years ago this past November, and it really was my goal to use the story to make a difference in the community and just help to raise awareness and provide AEDs to organizations in need.
Awesome. And Rich?
My name's Rich Fenice. I live in St. Cloud, Minnesota. I founded, along with my friend Joel Vogel, a nonprofit called Advocates for Health. Our focus is putting AEDs out in the public in outdoor AED smart monitored cabinets so that the AEDs are accessible 24/7, 365 days a year. We've got about 160 of these units out in our area. We're working with different other nonprofits as far as screening and just to get the word out and increase the survivorship.
Yeah, awesome. One thing to note is, we have 4 people here from different parts of the country. So I know, they would all, if anybody ever wants to get involved and help, I know, speaking as someone who works with a nonprofit myself, we're always looking for more help. So if there's someone in your area and you wish to help, definitely reach out. We can provide contact information for everybody here on the call. So I know we kind of talked about the mission and everything that, what we do, what you all do. And ultimately the mission for all of us is to save lives from sudden cardiac arrest. So if you could specifically talk, and I know you kind of touched on it a little bit, kind of like what your organization does, statistics, what you've done, if you want to talk about numbers of AEDs donated, and kind of, more specifically about, really the work that you're doing and why you do it. If we could start with you, Jamie, for this one.
Sorry about that. I was trying to unmute myself. Yeah, so we're a new nonprofit. We've been operating for about a year now, and really, my goal was to start small with this, and I've been really surprised and encouraged by our community who has been applying for AEDs. They want AEDs in their nonprofit organizations. So we're getting applications coming in all the time. And we have been really blessed to be able to donate 9 AEDs so far this year. And we have 2 more to donate before the end of the year.
Awesome.
So, yeah.
Awesome. Jennifer.
Sure. So we focus on 3 areas. We do heart screenings in the community, CPR and AED training, and AED donation. And for our AED donation program, we specifically focus on either high school, middle school, or youth sports programs and provide mobile AEDs. We have found that even though schools have AEDs, there's so many activities happening after school. There's no really access to those AEDs after school or at games or away games. And so we provide mobile AEDs. And our goal is for the schools to just have an AED like it's part of the equipment that they bring out to practices or games, like a first aid kit. So that's our goal. And we've done 15 so far in our area and hoping to do at least another 5 or 6 this next coming year.
Awesome. Rich?
Our focus, as I mentioned, is to get AEDs readily accessible outside. And to follow up on some of the other comments, what we've been doing is placing them in high schools and other schools and park systems and that sort of thing, and the whole idea is to make them available and make people aware that they're available. And as other people have said before, a lot of times they get hidden or there's just not enough access for that. And so we're trying to get them out and be very visible. We work a lot with other nonprofits like Lions clubs, Rotary clubs, and that sort of thing to raise monies to do this. And we've been pretty successful at doing that. Hopefully the other things that we want to do is more in the heart screening that other people are doing right now. And I'm real curious to hear the success there. I think that's the next logical step for us.
Cool. Awesome. And Joanne?
Yeah, I'd say the bulk of our work is really the donation of AEDs and the training of the public at large. We put, it's for a little over 550 AEDs that we have donated and have trained close to like 2,000 people. Either me doing that myself or through, awarding grants for other organizations to make that happen. And also on the legislative side, we found when we started our journey, and as I mentioned before, it's been 16 years. Really, there was not much of an appetite. People were scared to acquire AEDs, and a lot of that had to do with the legislation. So that's an important area for us. We were able to pass in the state of New Jersey the Good Samaritan law. We were able to get passed in the state of New Jersey CPR AED training in high schools as part of the health curriculum. And we follow the legislation on a national level as well as the state level and do what we can to make that happen. We're just getting into the screening. We did dip our toes into it when we originally started the organization. At that time, it was new and kind of, I like to refer to it as Wild West. And I'm so excited about the progress that screenings have made over the last 15 years. And that's something that we're just getting into now and excited about it.
Awesome. I think like an important piece to like what we all do is, placing AEDs is very important, but also just like in your own communities, like raising awareness and making sure people understand like what sudden cardiac arrest is, placing the AEDs, again, which is very important, but also making sure that people are not afraid to use them or that they are accessible and people understand, how to have like a complete AED program. So if you could just, take a second and just talk about how you've done and kind of navigated just raising that awareness in your community specifically. So people are more aware that sudden cardiac arrest affects so many people every single day. Rich, we could start with you for this one.
Sure. One of the successes that we've had, we partnered with a local grocery chain called Coburn's, and they have 120 locations throughout the upper Midwest. And last February, they had an Operation Roundup. And that was specifically if your grocery bill is $18.20, they round up to $19. And with that, they raised over $35,000. And with that, we put the AEDs outside the Coburn stores at the various entrances and partnered with other local sponsors, like, for instance, State Farm agents, banks, that sort of thing. And so with grocery stores, there's so many transactions and so many people coming through every day that see the AED at the entrance store. They can't help but notice it. And so we get a lot of response or awareness, just that people asking, what is that? And what does it do? We also do training with the employees of Coburn's and other people that we work with, and they have them in their stores, but they hide them. They're not readily available. And so our units are in their face when they walk in. And that's been pretty successful for us. And we just got a notice that they're going to be doing it again this year. So we want to encourage other grocery chains and other areas to do the same thing.
Awesome. All right, Joanne, we'll go right back to you.
Sure, Rich, you hit the nail on the head. I just think partnership is such a key component of raising awareness at the local community level. Plus, I wouldn't necessarily say nationally. I don't have much in the way of examples of that, although I hope we get there, but on a regional level. The grocery store partnership that you're doing, I just think is fabulous. For us, we've partnered with local hospitals, which has been very effective. They want to look good in their community. A lot of the hospital networks throughout the United States are merging and acquiring one another, like many other industries. So their community presence is very important to them. And also an AED being a medical device, sudden cardiac arrest being a health, condition. I just think the hospital partnerships for us, as far as, partnering with the hospital to get AEDs donated through the business community and training. We did one of those initiatives with Morristown Memorial Hospital locally here in New Jersey. The other thing that I found quite effective is my husband and I are Wall Street, our professional career background, or was at one time, and with the banks. Banks are also very much legally responsible to give back to the community. So some of the initiatives that we launched with them, and we're constantly in discussions, fundraisers in New York City. We've had like 7 of them so far, looking at having an 8th. Also partnering with them as far as like activities that the bank does in the Bronx. Which they would like to see us maybe do screenings at Bronx Community College, that type of thing. So the partnering is critical, and I find very much needs to be a key element in your success story.
Definitely. Yeah, Jennifer.
Yeah, so for us, since our focus is really in the sports programs in the schools, we've been working really closely with our school districts. And just awareness of I know before I even lost my son, I had no idea what an AED was. I didn't know what it did. I didn't know, it couldn't hurt somebody, all those statistics. And so that's a big one that we share a lot. And even when we're doing a screening, we'll say to the kids, hey, do you guys know where your AEDs are on campus? Do you know where they are? And even, we've provided just signage for schools because they have them, but there's no signage anywhere outside the buildings to let you know that there's an AED even in there. So even basic stuff like that and talking about it. and letting people know that they aren't posted somewhere in a public place because for medical people only, right? It's for the public to use. Again, that was something I was not aware of. So just those basic things, I think, just great letting people know that an AED is so easy to use and can be, used pretty much by anybody. That's a big awareness for us, and also providing AED training to a lot of the kids and CPR training on the school campuses, because here in California, it's not currently part of their graduation requirement to do CPR. We're hoping that'll change, and we're working with some of our school districts to get that changed. And hopefully the AED will be part of that as well. But and just we use social media a lot too. Obviously, social media is a great tool to use to get awareness out of just information about AEDs or your programs and stuff like that.
Definitely. Cool. And Jamie.
Yeah, so when we donate AEDs, we go out to the organization, myself and our team, and we have another sudden cardiac arrest survivor locally who comes with us, and we share our stories with the organization and their members. We talk about sudden cardiac arrest facts, and they'll ask us questions, and we, answer them the best we can with the knowledge that we have. We also like to reassure them that you can't hurt someone with an AED, and always you can see that exhale, we're okay, they feel a lot better. I think that's so important. We talk about that. And then we just, this past summer, we were on local news channels trying to get our organization out there and raise awareness. We went on a local talk show news story, and they were so inspired that the next day they brought local EMTs in to do an AED demonstration for their viewers, because even one of the news anchors was like, I don't even know where ours is in the building. And so it was when you have those conversations in real time, you get people, interested, and you get people thinking about, okay, well, this could really happen to me. How could I save a life? So we like to do that. We also partnered with our local community foundation this past summer, where they provided us with some funds to donate 2 AEDs to the local senior center. So we're still new, and we're still trying to form those connections and relationships with foundations and local companies in the community. So we're hopeful to grow that side.
Awesome. It's such a great, and everybody, all the awareness is so important, but we've seen the same thing here in Connecticut, and it's just we are seeing more AEDs, and of course there still needs to be more and more places. They need to be more accessible. They need to be outdoors, but we still see so many people so surprised when we tell them you cannot hurt somebody with an AED, or the only thing you need to remember is to turn it on. And really just kind of continuing to educate people of all ages that you can be empowered to help save somebody and use one of these machines, and get people comfortable using them is just really important. So my next thought is this. So I feel like for all of us, you sign up, you do this, and it's really like a lifelong task. It's really never-ending work, and we know what the survivor rates are of sudden cardiac arrest right now, and unfortunately they are still pretty low. So the next thought that I want to get from you all is what do you want to see in the future? What do you think is the next steps to really move the needle and improve that survival rate? And Jennifer, if we could start with you on this one, that'd be great.
Sure. So I think the biggest step is just debunking the myth that it's rare, right? Because especially in medical field, that type of thing, it's still considered rare in some parts of it. And so when it's considered rare, then nobody really wants to do any extra steps to help prevent it or detect any possible, especially in youth. We get that, well, they're healthy, they don't need to have a heart screening, those types of things. And my son was an active soccer player, and Claps playing some video games with some friends. So I think debunking the myths of sudden cardiac arrest will help us get more awareness of it and how often it is happening to people, and that we have not, the survival rate has not changed in like 30 years, I think that the number is. So I think that's a big one, right? Getting the medical field and other organizations and stuff like that behind it, that this is not rare, right? It's still one of the leading causes of death in our country. So I think that's the first one, and then I feel like it would all kind of fall into place after that.
Cool. Jamie, yeah, we'll go right back to you.
Well, so much of my survival was influenced by immediate action through the form of CPR and the use of an AED. So I think it's really important to really talk about how important that immediate action is. And so many people are afraid to do CPR wrong. So many people are afraid to use an AED. And so I think that the more comfortable we get people to do CPR and talk about CPR, help them learn about it, hands only, bad CPR is better than no CPR. I just think that that's really going to help with survival rates, or for bystanders to really just feel comfortable jumping in and taking action and knowing that they can't hurt someone, but that they can really save a life.
Yeah. Rich?
I think, the key to success is really it's awareness, but also saturation. And if you get the word out, we are a lot more accepted than we were 2 years ago, when nobody knew anything about an AED or what AED meant. And so it's much easier for us now. But the issue is whether in schools or shopping centers or whatever, they just hide them all the time, and we want to get them out there and available. It seems like they have laws requiring fire extinguishers all over the place, and yet a life-saving AED is hit and miss whether it's required. If it's a dentist's office in our state, it's required, that sort of thing. But there just needs to be more saturation of that, and that's going to lead to more survival.
Cool. Joanne?
Yeah, I like to refer to it as like a common language. I think you need two things, Mike, to get those survival rates down. First, it's the lack of understanding. The public just does not understand what sudden cardiac arrest is. It's not a heart attack, it's sudden cardiac arrest. It's and in order to get, we need to partner and all get together and get the public to understand what sudden cardiac arrest is. And we hear the term used improperly all the time. And I think once you understand what it is, then you realize that time is your enemy. You have to respond immediately. And once we do that, and there's been a couple different initiatives. I mean, I think of like with fire, like stop, drop, roll, and with cardiac arrest, called push shock. But how do we get that out there more in the public so that everybody's just rolling that acronym, off their tongue? So that's one thing, the understanding of sudden cardiac arrest. And the other component is getting AEDs in all places of public assembly. I think once you have the first, it'll be much easier to implement the second. But it's amazing. I've seen so much progress in 16 years, but we still haven't seemed to move the bar as far as survival rates. And I think it gets down to those two things.
Yeah, that's interesting that you say the stop, drop, roll. I never heard the comparison to call, push, shock. And I mean, I grew up, like, you start hearing about stop, drop, roll when you're like, I mean, I don't know, like you're watching like videos on like Smokey the Bear, I think, like in first grade or something, and they're talking about stop, drop, roll, and call, push, shock could be that. Which is really interesting. Okay, I want to kind of talk about, we all are super aware of this, and obviously have been affected in different ways, and I want to kind of talk about your thoughts on having a personal AED, because I think it's something that isn't talked about as much, and it's not something that we really do right now, the general public really does, is having an AED at home or having an AED accessible in your car. If you could maybe just talk about why, it might be beneficial. And I know there probably is similar answers, but why, whether if you keep one at home or in your car, why you do it, and some reasons why you think, it'd be beneficial for people to have one. And Rich, we can start with you on this.
Well, I have an AED in my car, and I take it everywhere, of course, and I've taken it golfing also, and you get a little bit of pushback on it and a little bit of laughs, a little bit of jabs, but you get the awareness. And I said, all I'm here to do is save your life when you go down. And so you get people talking at least, and again, the awareness issue is what I keep looking at, and I want to make sure that I'm going to do my part and try to save somebody's life. If I don't have an AED available to me, shame on me. But I want to practice what I'm preaching.
Yeah, cool. Joanne.
Yeah, great question or great discussion item, Mike. I have in the last year, for the first time ever, we've placed 2 AEDs in homes, and then 2 others in, I like to call them community compounds. They're really just vacation, like a family has 5 cottages that, have been passed down through the generations up in upstate New York at the lake. So they want to get an AED for their, for the extended family use. So that's new, and I just think that that's going to continue to grow. Personally, I have one in our apartment that we have in northern New Jersey, and also have one in my home down the shore. And the reason for that is my son passed away from hypertrophic cardiomyopathy, and we do not know, although he's been tested, but we still don't know whether my other son has it or my husband or I. So should one of us go into sudden cardiac arrest, you just hope that there's somebody around that can use the AED. But I do think that is something we're going to see continue to grow. I know one of the ones that was a couple. They have 3 children, and the husband was just diagnosed with HCM, and so was the son. And the cardiologist said you should have an AED at home, which was music to my ears, because I find a lot of time cardiologists don't even really understand HCM that much. So, when I heard that was recommended by the cardiologist, it was, really great. But definitely something that you're going to see, and I'm not a researcher or anything, but if, I was a betting woman, I bet that you'd see, more requests for and more placement of AEDs in homes.
Cool. Jamie.
Yeah, I think that's a really great question as well. When I think about that in this area, I think it's really important, as we have a lot of farmland here, and we have a lot of families who live on hundreds of acres, and they're nowhere near an AED. And I think that that's something that could really potentially be a great opportunity, even for us to promote and get involved with, is, placing these devices in with families. And I know for me, if there were one in our house and my husband was able to use that, I think that would have definitely saved a lot of what I went through in my recovery, having to be in a coma and all that kind of stuff. So I think that's a great thing for us to think about, and for people to think about. And as families, the communities hear us raise more awareness, I think that that's something that people are going to want more often with them and close to them, especially if they have a history of, sudden cardiac arrest or heart disease in their family.
Yeah, definitely. And Jennifer.
Yeah, so I also have an AED here in our home. Same thing as Joanne. My son passed of an enlarged heart. We don't know what caused his enlarged heart, and so until we figure that out, if it's genetic or not, I have a daughter, and we just want to have it in our house just in case, God forbid, something happened. But yeah, I don't have a whole lot more to add than what everybody else said, but I do think, as Joanne said, that's something that you're going to see more of. I know that especially like with children, getting diagnosed with like a long QT syndrome or those types of things, WPWs, that I've heard that that's happening more often, that doctors are recommending that they have an AED in the house, which makes complete sense, right? That's if you're, got other ailments and stuff, they prescribe things for you. So that should just be part of what's prescribed. And so, yeah, I think that we'll definitely see those in people's houses and homes going forward.
Definitely. There's a couple things I want to add, and like the American Heart Association statistics says flat out that 7 out of 10 sudden cardiac arrests happen in the home. So 70%. And I know one of the things that all of us on this webinar right now talk a lot about is something, everything that's done prior to the ambulance showing up. And like we know that if an AED is used prior to an ambulance showing up, survival rates skyrocket. And, so knowing that, 70% of the sudden cardiac arrests are happening in the home, knowing that, an AED needs to be used before an ambulance shows up, it just, it makes a ton of sense. And I know there's obstacles and there's different reasons why people don't. And our goal by having this discussion is just to raise that awareness and make sure people understand, the benefits of having one of these machines at their house. And, in case, you were ever considering it and maybe not totally understanding why it would be beneficial, you kind of have an idea why now. So a few more things I just want to talk about before I wrap up. I just would love to hear from each of you if there's any specific like wins or things that have happened with your organization that you want to share, whether they're an AED that you donated helped save somebody, or if it's even if it's just a group of people that you just completely educated about sudden cardiac arrest, or a condition that you might have caught in the screening. If you could just kind of talk through any sort of things that you're super proud of, or things that have been big wins for your organization. Jennifer, I'll start with you for this one.
Sure. So a couple come to mind in regards to, well, we donated an AED earlier this year to a very large outdoor sports complex in our area. They have like 10 soccer fields, and it's just a huge complex. And we donated an AED. They had no AED there when in the thousands of people come through there all the time. So we donated an AED, and as part of it, we, my husband and I did CPR and AED demonstrations. They had a soccer tournament that same weekend. And the AED hadn't been there 24 hours and it had to be pulled for a parent that had collapsed on the sidelines. Luckily, it didn't have to be used, but standing there talking to the EMT, they said this is invaluable to have this on the sidelines, because by the time we get here and get into the middle of the complex, that's precious minutes that pass that this person could not survive because there's not an AED. So they were just so excited to see that we were actually standing there holding the AED when they showed up, just in case he did go back out and unconscious. And for our screenings, we've screened 2,300 kids since 2019, and have identified 24 with some form of an abnormality. Some may not cause cardiac arrest, some are just awareness or they need some follow-up on. But that for us is huge, because those are 24 youth that otherwise wouldn't have known that they had an issue. And we've had a couple who've had to have surgery, had a hole in their heart. A young man had bicuspid valve issue that has to have surgery on his valve. So those for us are huge. Because for me, being a parent who's lost a child to cardiac arrest, knowing that I'm possibly helping that family avoid that is a huge win for me, and that's what motivates us to what we're doing every day. So
yeah, amazing. Rich?
What's been rewarding for us is that we've had saves now because of the AEDs we put out there and made available. And when you talk to the families afterwards, and just the difference that it's made in their life. And it's just whether the young kids or an older person, the same issue, that if they die, they're gone. And it just makes such a difference in the families. They're just so appreciative of the work that you're doing. It just motivates you to keep going.
Yeah, awesome. Jamie?
Well, I think it's really been encouraging that we've donated 9 AEDs this past year. We've just started, and I think it's been really great for us to, go out and meet with these organizations everywhere, every place from senior center to youth centers. We're getting the story out there, raising awareness. We also received a governor's citation for the state of Maryland for the work that we're doing in raising awareness for sudden cardiac arrest. So I think that's really exciting. And just the fact that, people are talking about sudden cardiac arrest more than they were, even with like my example of us going on the news, and that they were inspired to have EMTs come the next day. And it's just like it's like a trickle down effect. So I think that's really exciting. And our goal is just to keep going and hopefully donating more AEDs and continue to raise awareness.
Cool. Joanne.
There's probably three things that stick out in my mind. One is on the AED donation side. When we donate them, especially the schools, we usually work with the school to put together a sudden cardiac arrest response plan. And one of the AEDs was used to save by the rescuer was a school nurse who was a personal friend of mine. I was working on the plan with her at the time. We just outfitted the school with AEDs, and the 26-year-old gym teacher had sudden cardiac arrest. And little did we know until after she was revived that she was 8 weeks pregnant. And she now is on TV commercials for University of Pennsylvania Cardiovascular Center. I think her son is now, he's like 9 years old, but that in itself is a miracle. And the second thing is on the legislative side, I mentioned we were very honored to have the governor at the time, Chris Christie in New Jersey, agreed to do a public signing of the bill for the CPR AED training in high schools, and we were invited to go to that. And with all our legislation, at least here in the States, I like to get the high school students involved to do the testifying, and that's a very powerful tool. It's amazing how our state legislators will listen to high school kids, especially when they take the time to prepare a one-pager and do some research on the topic. So that was just a really special moment for us. And and I would say most recently it was earlier this year, I was asked by Spotlight on America, which is part of Sinclair Broadcasting, to be interviewed for a piece, which I went down to DC to do the filming. And that was like why it was an investigative report focusing on why AEDs are not in all public schools. Mm-hmm. So that was shown through their 72 networks, ABC, NBC, Fox, earlier in the year, and is on YouTube now. But those three things really stick out in my mind.
Awesome. Yeah, it's amazing. Two points, and we're gonna wrap up soon, but and I know we could probably all talk about this for hours. But the one thing is when it comes to screening, I know Jennifer, you talked specifically about the kids that you caught, and I think screening, like on the surface, it's really easy to say, okay, we to notice, right? We screened kids and this kid has this disease. But I think it goes so much more beyond that. And what we've seen as well is like, yeah, you do catch kids that could have potentially life-saving, a life-threatening heart condition, which is amazing. But also there's the ones that are kind of like in the middle of like their EKG wasn't completely within normal limits. It wasn't completely abnormal. But now this family, even if it's somewhere in the middle, has this knowledge of like, now we just need to keep an eye on this. And I think that's like super important. And on top of that, just the education that you provide when doing a screening of like, even for the kids that all have normal EKGs, now these families are just aware of like what they did. They're telling their cousins, their relatives, their friends of like, this is what we had our kid do. You should do it as well. So that was one point I wanted to make, and I think that's really important. And then the other point was just the impact of the work that everybody on this call is doing. And again, on the surface, it's super easy to see like, an AED was placed and that AED saved somebody's life. So it's very obvious to see that impact, but I think it goes so far beyond that. And again, it's credit to all the work that you're doing. It's not just the life that's saved, it's the family, the friends, the community, and then the lives that are saved because that life was saved, because of the additional awareness that was raised. So just 2 points I just wanted to kind of make that I think are really important, like, because it's easy to see, yes, AED is placed, AED saves a life. That person is so grateful that that AED was there, but it goes so much further beyond that. So before we wrap up, I just want to give everybody an opportunity to go around, and if you have anything else you want to add, number one, and important, very important, I want to make sure you talk about how people can contact you and how people can find you, because these are all relatively smaller organizations that were started off passion for studying cardiac arrest, and the more people that are in the fight to help, the better. So Rich, if we could start with you again, if there's anything you want to add, and then just talk about if people want to contact you and get involved, how can they do that?
We're on all the social media, and so you can contact us through that any way you want to there. We get so much reaction and are able to help other people in other parts of the country as far as setting up programs and that sort of thing, and just educating them what's going on. So I'm glad to help anybody out, and just call me and or email at any time, and we'll get back to you right away. And thank you, Mike, for putting this together.
Awesome. Jamie, I'm going to go to you. So I know we can say that Jamie's a teacher and she's in a break period right now. So I don't know if students are waiting for you. So you can go ahead and obviously feel free to jump off whenever. So
Appreciate that. Thank you. I'm so glad I was able to attend this call today. Thank you, Mike, for putting this together, and just for all your support for this past year for us. So we have a website, thebeatgoesoninc.org. You can email us at contact@beatgoesoninc.org. We're also on Facebook and Instagram, so you can reach us that way as well. And we're actually currently having a fundraiser right now. One of our team members, Charlie Nordoff, a fellow sudden cardiac arrest survivor, has handcrafted some gunning canvasback duck decoys that we're raffling off right now to help raise money so that we can donate some more AEDs. So if you're interested in that, you can go to our Facebook page and check that out. And just thanks everyone so much.
yeah, that's a true nonprofit owner, executive there. It's like ABF, always be fundraising. You always have to be fundraising. That was good. Jennifer.
Yeah, so we're also on all the social media accounts, and you can find us at kylejtaylor.org. Reach out, and we're always looking for volunteers. We do a lot of heart screenings in our area, so we're always looking for people that want to help out and screen. We're very busy with, I forgot to share, one of our wins was that we got our local school district to require screenings as part of their pre-participation physicals. And it's the first in the state of California to actually require this. So that was kind of a big win. We just got this last year. But anyway, yeah, we're always looking for people that want to help, or if you know of someone locally that might be interested in helping out. Like Mike said, we're all small nonprofits and run on volunteers and fundraising and that type of thing. So, but yeah, you can reach out, and be happy to talk to anybody or provide any more information as well.
Cool. And Joanne.
Yeah, I guess my last thought is, when it comes to sudden cardiac arrest, the worst thing you can do is do nothing. So that's something to think about. But as far as contacting us, we love volunteers. We're an all volunteer army, I like to say, in that no one takes a salary for what we do with our foundation, including my husband and I. And you can reach us at www.jtbfoundation.org, and we're also on Facebook, John Taylor Babbitt Foundation, Instagram, Twitter. Yeah, just thank you, Mike, for putting this together, and hopefully we can have more of them in the future.
Yeah, definitely. Cool, awesome. So thank you. Couple final thoughts, and people just threw some comments here in the group chat. Just one that's interesting was there was they said, are you aware of the $5 million settlement last week in Federal Way, Washington? High school had an AED at a gym, but not in the field of play. Athlete went into cardiac arrest. AED was never deployed. And basically the basis of the suit was improper training or coaching staff and failure to deploy the AED. Again, that just goes on what we talked about, and just a quick point to go off of that. A lot of people talk about liability. We've seen the liability is more of not being prepared. It's not having the AED there. You do need to maintain the AED if you have it, but the liability is not being prepared. And another point that was made, if you do have a home AED, registering it with Pulse Point, you can get notified if there's emergencies in your area. That's a good thing to know. And then one comment was from someone, keep up all the fantastic work. You are making a life-saving difference. And there are the Sudden Cardiac Arrest Survival Summit hosted by Citizen CPR Foundation does have a call for presentation. So if you ever want to, I've done it actually, go down there and talk about your organization, talk about your story. That is an opportunity for you all to do. So, so again, thank you everybody for joining us. Thank you to our panelists for the inspiration and for everything that you do. Like we talked about, this is it's kind of a never-ending mission that we're all working on, and we're going to try to keep getting that survival rate to go up. So, if you're an organization that wants to get involved with the Defibtech, like these organizations are, you can reach out to us, at www.defibtech.com. My email is just mpapale@defibtech.com. So thank you again for joining, and hope to see you all soon.
Thank
Thank
you.
you.
Thank
Thanks.
you.